Every year, 30 to 40% of Americans make a New Year's resolution. 25% of those are to get exercise, more fit, lose weight. Sometimes that is a whole lot easier said than done, but it doesn't have to be.
If there's a rowing machine at the gym, there's a good chance you'll find Bill Milliken using it.
I'll probably row 5,000 meters. It's about 25 minutes, 25 minutes.
It's his favorite piece of equipment at Cone Health's Sagewell Health and Fitness in Greensboro. His routine also includes riding the exercise bike and lifting using cable weights.
Go down and work on some machines, chest, shoulder, pull downs, dips, and then get on the bike and try to do 5 to 8, and that's a good day.
The 66-year-old hasn't always had a routine like this. It started with a minor health scare last year.
It was a wake-up call. A while back, I was hiking actually with my daughter, and I just happened to have a general physical coming up the next week, and I mentioned to my physician, my primary care, hey, I was feeling this on my left, and I always had heard that that's a bad sign for it. And she goes, yeah, that's a bad sign. Next day I was at the cardiologist, CAT scan, EKG, everything. And they did find a little aneurysm.
Milliken knew he needed a change. Sagewell personal trainer Dylan Confar has seen all types of motivation.
There's a lot of people who really kind of have that carrot on the stick, right? You know, like they have that weight loss goal, they have that event they're kind of waiting for. Maybe it's like a cruise they want to look good at.
He's heard the reasons why clients want to start their fitness journey, but knows it takes more than good intentions.
Having those three things are super key to fitness. So it's competence, knowing what you're doing, community, also having a choice in what you do are the big three main factors to being able to stay motivated.
As for Milliken, he's now a regular at Sagewell.
Yeah, I'm in a good place, just like Dylan alluded to. I'm over the hump, and I'm not here for New Year's.
Confar knows it isn't easy getting started.
But the more you force yourself just to go, do anything. You even show up to the gym, walk in, turn around, that's day one, you know? It's gonna take you 2-3 weeks. So the sooner you start, the more it becomes a habit.
And Milliken can attest to that after only 5 months of exercising regularly.
I mean, I'm blessed to be in the condition I am, yeah, that's the motivation. Is I don't like doctor's offices, I don't like pills, and I need to do whatever I have to do to avoid those.
There's no pharmaceutical that's going to replace exercise and fitness besides exercise. And I tell people, you know, you're going to have to see it yourself to really see how that fountain really works.
Well, we just heard one person's success story of how exercise and movement were key to their health and wellness. Tina Bailey, a personal trainer with Cone Health Sagewell Health and Fitness, with us to continue that conversation. So let's just start, why movement and exercise is so important, not just for the short term, but for long-term health.
For long-term health, it's definitely important for managing weight, boosting metabolism, and more importantly about building strength, which builds muscles and also helps with making our bones stronger. People don't realize that as we get older, our bones get more brittle. And what they need is that exercise, and especially resistance-bearing type exercise, to keep the bones strong. So also it helps with reducing anxiety, improving sleep. There's so many benefits to long-term exercise.
Yeah, and it's not just because you want to fit into a pair of jeans, it's because you want to be able to move and move well for a long period of time. All right, so let's talk about the benefits, the improvements in one's life that you've seen in folks that have been working with Sagewell.
There's so many different ones. We do a lot of medical fitness here. We're obviously open to the general public, but because we're affiliated with Cone Health, we do a lot of medical fitness. So we get a lot of referrals from physical therapists and physicians. Once a patient has gone through the process, whether it's a hip replacement surgery, and they've gone through physical therapy, but they want to continue getting healthy. So today is such a great time to be in this profession because physical therapists and physicians are understanding the benefits of continuing that exercise, because they're targeting that one, let's say the hip replacement. They're targeting that hip. They're trying to make that better. We come in after the fact and we not only focus on that and any prescriptions that as far as exercise that the physical therapist gives us, But we also focus on how it impacted the rest of the body. It can impact the posture. It can impact how they walk. So we work on improving that. So you can see people come in and post-surgery and they're using a walker. And then a few weeks later, all of a sudden they walk in and they're using a cane. And then a few weeks after that, they don't need any assistance to walk anymore. So that's what's so great about medical fitness.
Okay. You know, for someone that's just starting out their exercise routine or starting over for the first time or for the 11th time, how often do you have to exercise to get results? And when should you expect to start like feeling that positive or seeing the benefits of that?
So we recommend at least 3 to 4 times a week, minimum of 30 minutes for each workout. And you want a good combination of not just cardio, but strength. That's actually as important, if not more important than just cardio. Cardio is great for heart health for sure, but resistance training and strength training help with, again, building the muscles, making the bones stronger. So if you get committed to this and you're here a good 3 to 4 times a week, you should start seeing the benefits, or at least feeling the benefits within a couple of weeks. And then to really start seeing changes, it takes anywhere from 6 weeks to 8 weeks to see those physical changes start to happen.
All right. So 6 weeks to 8 weeks, it sounds like, oh, okay, I'll be seeing it. And then you start calculating, you're like, ooh, that's a long time. So how do we stay motivated? What are some ways to keep that motivation going to stick to that fitness plan?
The biggest motivation I've seen is a lot of people want that accountability. So they want, whether it's a partner, a workout partner, or even a personal trainer. I mean, a lot of people do actually just hire personal trainers solely because they want that accountability, because they know if they make that appointment, they're going to show up. And you also want to make it fun, although I hear a lot of people say, well, exercise is not fun. I don't see it as fun. But there are ways that we can tweak that so that it is fun, and it needs to be convenient. It needs to be convenient to their homes or their work. It needs to be a convenient time of day. So those are all factors to work in to keep you motivated so that you don't burn out or feel like it's just another inconvenience in your day.
Okay. How about the difference between fitness and like medical fitness? Because some people would benefit from medical fitness, but they just don't know what it is.
Okay, so that's a great question. Medical fitness, and it's one I've had a hard time, especially with my family, describing what I do. General fitness is basically about physical improvement, often aesthetic, and it's kind of a one-size-fits-all. Just come in, we'll show you some different exercises to work the entire body, and then you're off and running. Medical fitness is a lot different, and this is kind of simplification here, but it's almost like when physical therapy benefits run out, we step in, and so we still consider the injury or the illness that person was seeing a professional for before, and then we take it from there and keep that in consideration as we target the entire body. So that's the difference between medical fitness and general fitness.
So we often hear the term moderate exercise, but what exactly does that mean? What are we aiming for?
Simply put, you just want to feel your heart rate rise, but you want to still be able to have a conversation, be able to speak. So that's moderate exercise.
Okay, so let's talk about the difference between strength training and cardiovascular exercise, and maybe give me an example for each one so that people know, oh, that's what I'm doing, or that's not what I'm doing.
Right. Okay, so strength exercise means you're doing resistance type work with, whether it's strength machines in a fitness center or even free weights. Cardio, you're actually improving your cardio health. So you're running, you could be walking. We have a nice indoor track here. So this time of year, it's nice to get on that track and walk. You can be on a bike, playing tennis. That's considered cardio.
Okay. All right. So that gives you kind of like some options, and it doesn't all have to fit into that box. There are so many different ways for you to do strength training and cardiovascular. So
Sure.
Let's talk about someone managing maybe a chronic condition, or maybe they have pain and they're worried that exercise could maybe make that worse.
And we see that a lot. What people don't understand is when people are in pain, they stop doing things, whether it's a shoulder injury or arthritis. And actually, not doing anything is the worst thing that you can do for yourself. So moving, even though it may feel like it hurts more at first, especially if you're just beginning, it actually improves the pain level. It actually reduces inflammation over time. So movement is the key to overcoming some of those chronic conditions. And can it make you feel worse? Possibly in the beginning, but again, with commitment and as you go through it, our job is to not send you home in pain. Our job is to ensure that we're addressing those issues so that eventually, all of a sudden, you realize that doesn't hurt anymore. So, it's up to the professionals to help you through that piece.
That's right. And of course, you can learn a little bit more about Sagewell and how to start your fitness journey. All of this is going to be in our To Your Well-Being on our website, WFMYnews2.com.